we used to do that out there. We'd have we even buy stuff we needed to do, fed off sleep stuff and things like that. We'd open.
For the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning, everybody.
Great.
First, looking for approval of the agenda.
So moved.
Second. We have a motion and a second. All in favor? Aye. Opposed? Motion carries. Approval of minutes from April 14th, 2025.
I thought they read well. I'll make a motion to approve the minutes.
I'll second.
We have a motion and a second to approve the minutes from April 14th. All in favor?
Aye.
Opposed? Motion carries. Item number 1, Sheriff Quarterly Report from January, February, and March. Good morning, Mr. Henry. How are you?
We'll find out.
We push that little button on your thing.
Hold it down.
Hold it down.
There you go.
There you go.
Well, in the interest of brevity, I'll just, the quarterly report for January 2025 through March 2025. The sheriff's office took in $144,789.18. And then, once our fees were paid out of that, we ended up with a total of $143,557 for the quarter. Most of which is room and board, of course.
How are things going over there? Good. You guys
Good.
been busy or?
Busy. Busy.
January was kind of almost a record month, wasn't it?
Yeah, pretty close. And then it kind of tapered off a little bit with the winter. But yeah, Polk County's coming today and picking some up and bringing some more. So
How many you got in there today roughly? Or will on the other day?
30 some,
Couple local and the rest are all out of county.
pretty much. Pretty much.
Still want to watch that transfer sometime.
It's not much to see.
Still get quite any amount of Calhoun.
Yeah, I don't know the exact number of Calhouns,
No, that's
but
fine.
there's
But it would seem like
more Calhoun than there are Carroll County in there. I can
Yes,
tell you
sir.
that much.
That looks good.
So, any other questions for me at all? We are taking applications for a deputy right now. That's not panning out the best so far. We've only got 2 applicants back. So,
Wow.
Are they, will they need to go through training or?
yeah, neither one's certified.
Okay.
So, and I think we're taking apps until the 16th of May, if I remember right. So,
When did you let about Thursday, Friday last week or
no, it's been a couple weeks
couple
now.
weeks already?
Been a couple
Wow.
weeks.
You only got 2.
Yep.
I've seen it on Facebook. I mean, it's been.
Yeah, I've seen it
Yeah,
on
it's
Facebook.
out there.
Shared around.
Okay, as long as it's out there. I don't
Yeah.
have Facebook.
It's out there.
I
Smart
just
man.
I just take their word that they put it on there.
Yeah.
Is it a
Yeah.
statewide deal? You put it on too, or
It's just, it goes on Facebook and then it gets shared and
okay.
so.
I
It
do have
reaches a lot of people.
Question for you. I see here with the claims lately, it seems like we're having a lot of stuff starting to have issues over there with maintenance problems.
To me, it's been that way since day one, almost.
Yeah, I know we've had some issues that they got covered on warranty, but it seems like
We've-
lately.
Pretty much not much is covered under warranty. We did have a compressor go out on one of the rooftop units, had a leak in it or something. And Grease agreed to, part of it was under warranty, but the labor wouldn't be covered. And they agreed to take care of that whole bill.
Well, I mean,
So-
it seems like, I think I've seen some stuff with the softener and other plumbing issues and.
Yeah, the softeners, we fought those. I think that problem's been resolved.
Okay.
Bruce came up and took a couple times, but he finally figured out a solution, and now, knock on wood, it's been probably 5 or 6 months and everything's working good.
Okay, all right.
So. But yeah, as long as there's that much wear and tear on that building, of course, there's gonna be issues.
Well, if those numbers, you're using it.
Yeah, it's getting used.
That's a good thing.
But anything else for me?
I have no further
Nope,
questions.
we're good.
Thank you.
All right.
Thank
You
you.
guys have a good Monday.
You
You
too.
too.
Item number 2.
Now, we need a motion to accept the.
So moved.
Second.
We have a motion and a second to approve the quarterly report from the sheriff. All in favor? Aye. Opposed? Motion carries. Item number 2, new opportunities, opioid presentation. We have Chad and Christy here. If you guys want to come up and turn
Good
that
morning.
mic
Good
on.
morning.
There you go. And you might, do you know him, Mark? Okay.
Just early this year.
So as you guys know, we had, Christy, you said you watched our last couple of meetings. We have roughly $280,000 that had been in a CD, and it just came out of the CD last week. So we are, I don't want to say open to spending it all, but we've heard from you guys. We had a workshop 2 years ago, year and a half ago, on possible uses. You sent me the things, Exhibit 1, I believe it was called, on it, on things that could be used for. So you want to give us an overview of your thoughts, and we'll ask some questions.
Absolutely, and just some folders here. To talk through, and it's maybe a little redundant for some of you, but with Mark, I just kind of wanted to give a little bit of an introduction to myself as well. So I've been with New Opportunities since 2011. Started as the prevention director, and my start date was actually moved up to make sure I could get to Sioux City for a strategic prevention framework training. Because that is now the model that SAMHSA, which is our federal funder, that wants us to follow, because prevention science has really changed and improved over the years. And so I've started since day one, really looking at, assessment and all of the nerdy science stuff behind prevention to make sure what we're doing is going to work and that we're using our funding wisely. And so in moving forward, and that's also why I wanted to make sure we reviewed that Exhibit E, is because it outlines their core strategies and other strategies that they're wanting to fund. And so, as we were talking earlier, with all of the changes going on at the state level, especially with the behavioral health region, that's also pulling in our substance use disorder prevention and treatment and recovery work. So we've got a lot of uncertainty right now in terms of where that's going. And so my initial ask, or our initial ask, included some prevention work. And right now I think it might be wise to put that on hold until we see what shakes out, because that is also going to be adding in some mental health promotion. And we'll be able to really look at, what strategies and approaches can we use that can maybe address multiple factors and not just one. And we also already have some other projects that aren't going to be impacted that do address opioid specific.
Are you doing, so New Opportunities has, is it 12 counties?
7.
Seven.
5 counties for substance use disorder.
Okay, so are you have any of those counties allocated funds to you for opioid?
Yes.
Okay, thank you.
That's why we're kind of wanting Carroll County to move forward sooner than later, because one of the projects that Christy's going to talk about, it needs all the counties to come together to help fund this position.
Yeah. And so I can maybe just skip to that. Within this folder, though, it does outline a lot of the work that we are doing and the partnerships that we do have addressing opioid work. What we would really like to get moving sooner rather than later is the peer recovery specialist. It is something that was really highlighted in and at that training that we were at a couple of years ago. Because when you look at the continuum of services, Carroll County has some really great prevention work. We've got treatment providers. The need area I see for us in terms of long-term recovery is those additional recovery supports. But it also hits prevention in that most folks who are using opioids don't start using until. So we've got a lot of things that hit those earlier age brackets. But those, when you think about a 25-year-old, you think about young parents and folks that may be having children. And when you think about the things that children come up against in their lives and having a parent or an adult in their life who does use substances, uses opioids, has what it's called an adverse childhood experience. And the more of those adverse childhood experiences they have, the more likely they are to have additional problems as they grow up. So if we can put in these supports and help build resiliency with that adult, that parent, that family, we are in turn doing prevention for these young ones as well. So things that a recovery coach or recovery support specialist does is connects with the person in services, and even after services, with life experience, someone who has been able to overcome active addiction and make a lifestyle change. I don't know how many of you have made lifestyle changes, healthy diets, doing different things to just be healthier. It's not just a one and done, it's a constant effort and focus and need of support and those extra, infusions of you got this, we've got this, and we can work through this together. It's just an incredible thing that we've seen work in many places. Audubon County participates in family treatment court. They have family or peer recovery support specialists down there that work, and the way that these individuals can connect with someone who might even be ambivalent about starting the treatment process and being in recovery can just really help them make that turn. And it's just a whole nother level of investment in treatment and recovery that we see for a lot longer term. And I'd really love to see you have your support in building that for.
Is there, you said, talked about 25-year-olds, a lot of these people start at the opioid. Is there any way you can start sooner to prevent those 25-year-olds from getting out there, or?
Yep, and so we do a lot of school-based work. And a lot of prevention efforts. Once, you get to about that 18 mark, they're not in school anymore.
Yep.
We do a lot of work at workplaces. We do workplace policies and we do trainings in workplaces. There are some efforts with the prescription monitoring program. The data shows Carroll's prescribing rates have gone down dramatically over the last 8 years. So there are a lot of those efforts in place too. And a lot of times people aren't necessarily, for lack of a word, choosing this to be a thing. They get injured on the job. I've hurt my back, and then I've gotten this prescription. And even though the doctor is following their prescribing, it causes a lot of problems. I know when I broke my ankle forever ago, they gave me gigantic bottles of meds.
Sure.
They don't do that anymore, thank goodness.
Right.
But there are still people that got those gigantic bottles of
Nope,
meds.
I was just if you get
Yeah,
started.
so the prevention that we're doing in the schools and different places like that, one of the things, and I was talking to Gene about this last week, is that because a lot of our prevention grants are through the state of Iowa, we have to use, and we appreciate and we know that they work, research-based prevention programs. So they're not one and done kind of programs. It's really important that when this new committee gets together, that when you're looking at prevention programs for opioid, those one and dones yeah, they're interesting and they're fun and, you know, all of that for that one time. But statistics show, and we've got research to prove that certain programs, when you do them over a period of 4 to 6 to 8 weeks, and it depends on the curriculum, it depends how it's been set up. That's what truly makes a difference in a person's life. Truly, when they get into their 25 and their 30s, they're still able to remember or have some of those things built into themselves, their minds, of how to not get involved with that kind of a situation as best they can. So
Thank you.
Christie, I know you were talking about that billion bill pledge that the governor pushed out a couple years ago. Supposedly Carroll County, I heard somewhere, was one of the leaders in that.
Yeah, we have some really great take back initiatives in Carroll County. Several pharmacies take back, and we've got the permanent take back upstairs as well for the DEA. Take back initiatives are something that is also an allowable project.
Do you guys have any more questions?
So yeah, that recovery coach is really the piece that we're really pushing for right now.
The recovery
Obviously, when a
stuff.
person has an opioid addiction, they're gonna come into us, we're gonna evaluate them, we're gonna get a treatment, we're gonna do all those kinds of things. But this recovery coach is that frosting on the cake that's gonna really help a person to get into recovery and stay in recovery long term. And the nice thing about if Carroll County were to support this, as other counties, we're gonna be able to financially support at least one, if not two FTEs. If only one county were to support it, we would be able to hire a part-time 20 hours a week or 10 hours a week. But as we all know, people want full-time work, they want benefits and that sort of thing.
So do you have interest in the other, are there other counties interested in?
Yes, and they are funding.
Okay.
They are funding. So that's what,
Funding at what level?
well,
So the initial request was for 1/5, so about 15,000 for the year. And I should also include that this would be a sustainable position to some degree, because we'll be able to start billing Medicaid and some insurances for this, and there are some other pockets. It's really just the getting started, since it's a brand new service that we could really use the extra help.
So right now you're offering recovery coach, but it's a part-time position.
Right now, we do not have, we're wanting to get one started, we're looking to hire.
so again, 1/5. We have
Okay.
5 counties, so 1/5 is the ask. And just to overemphasize it, we are believing that this is gonna be self-sustaining, that once we get it up and going, it is gonna pay for itself. So we're not gonna keep coming back, you know, every year or 2 years. We believe once we get this thing rocking and rolling, Medicaid, insurance companies and that sort of thing, they do have a history that they will pay for it. But it's slow. I mean, you know, anytime you start a new program, it's slow to start. And so that's what I guess basically we're wanting to start it. Yes, I didn't think of it that way.
Started money, then sustain it
Yeah.
after that, yeah.
I had a question, and I lost it.
So have you given presentations to the other counties in the region about this? And are they on the fence? Are they thinking, or have
You are currently on board,
and have you received funding from them yet? Okay, so the funding is just sitting idle right now while you're implementing it.
And we need to get at it. We need to, I mean, because those counties, because they've given it through us, they're like starting to be like, okay, what are you doing with the money? And so.
Which will be the same way. If we were,
Absolutely, and we plan to give you monthly reports, quarterly reports, yearly reports, whatever you're asking. We're very used to it. We do this for our state and federal funding sources, that we're used to those kinds of detailed reports, so we're not.
So your ask is 15,000.
And did I understand you right, that you're saying you think with the way things are with the state right now, we should hold off on the other stuff?
I would put a pause on prevention until we know what it's going to look like.
are you talking the HHS? Would,
Yes.
I sat through that meeting. I think you were on there too. Yeah, Mark, you
Yeah,
were
I
on
was
it.
on
Yeah.
there too, yeah. Nobody knows what's going on yet, do they?
Oh,
They may, but they're not telling us, put
we-
it that way.
Exactly. We're hoping May or June, hopefully way before that, but we've got
Yes.
a feeling it might not be until. April.
I don't know that we're gonna make any decision today, but I did like Maggie's thing of how the Dallas County model as far as. The next item is, which I'll get to in a second, but you, Christie said you watched and you read the Dallas County. Do you like that approach?
I like the idea of having stakeholders at the table to really make sure we're not duplicating efforts.
Because there's a lot of different disciplines in there, from law enforcement to county attorney to
Pharmacist.
ambulance, pharmacist, yeah.
Yep, and that would also help highlight any needs or gaps that maybe
Yep.
we aren't aware of just because we haven't had the chance to have those deeper discussions, but. I also sit on the evidence-based practices work group with the state, and so I have my nerd file with me actually, of different strategies and approaches to address different areas and subject matters as well, so.
So that evidence piece is really, really important. That evidence, research-based prevention piece is gonna be really important for that committee to look at. The other piece is that duplication of services. New opportunities, we have had that prevention grant. It's called, used to be called Iowa, the Comprehensive Prevention Grant, now it's called the Iowa Provider Network Grant. We've had it for well over 25 years. So we're already in the schools, we're already in the workplaces, we're doing a ton of prevention work. And so I would just hate to be competing for instance, Kemper or Carroll to have to compete with. Because with our state grants, we have to do a certain number of hours, as Gene knows. And so it's very important that we keep those subcontracts, those things that we're doing with these different entities. So if another prevention entity were to come in, then where are those state dollars gonna go? Potentially, they would go to another county, which we should be keeping them in the counties they've been allocated to. And it's not exactly an allocation, but hopefully you know what I mean. We try to spread that out. So.
Okay, or today's not decision day, it's just presentation day, but I like everything I heard. Does anybody else have questions?
Sounds great, really does. And we prevent some of these people from making better people themselves. That's a good thing.
Absolutely.
Well, I kind of like your thoughts that we hold off on some of this till the state gets their act together, basically. For better lack of terms.
Well,
But I understand this other program, that's got some priority to it.
and then we can come back and tell you exactly, Gina, these are the programs that we're gonna keep doing. Because we know we're gonna keep doing a lot of these preventions. We just don't, a lot of these programs, we just don't know to the extent. We're hoping that that's gonna all stay at 100% of prevention of what we're doing. But if they were to come back and say, well, you're only gonna have 80% and the other 20% of that funding is gonna go to the districts, and the district's gonna decide, it could get a little jumbled. But then we would come back and we would say, well, you know, this is the plan of what we're gonna do with those prevention dollars. So to ensure no duplication in Carroll County. So.
Yeah.
Well, that's one of the things I don't want to see is duplication.
Yeah.
Right.
Is that everything on your presentation, you think?
I have a question for Christie.
Okay, go ahead.
You somehow, when we were on the phone, you were able to look up and see that over the next 10 years or whatever the number was, we're gonna get 464,000. Was that the number?
Oh.
And we've received we've got a little,
My nerd file.
because I didn't know that number was probably.
Well, I knew it's supposed to keep, we're supposed to keep getting money over 14 years.
So
My
we're,
understanding was a lot of it has been paid up, some of them
yeah, I
just
was gonna
paid
say,
up.
we're
front.
over halfway there right now and we've done nothing with it yet. Other than earn interest, which,
Yeah,
Sorry.
465,
okay,
36 cents.
yeah,
But
thank you.
that is not a total true figure neither, because I think they're going after more companies, aren't they?
I'm not sure if Carroll County is gonna join that class action going after the pharmaceutical benefits manager. So, okay, I was thinking 460, you can take it back. I was thinking it was 464,000. So we've received over half of it, so.
Okay, Ian's there here, and I visit with you a little bit
Yep.
about a letter. Chad has reached out to me there, your organization, the group of
Yep.
action agencies.
Yep.
Maybe you want to explain that.
I would love to. So, new opportunities, we are a part of the Iowa Community Action Association and also the Iowa Behavioral Health Association. And so I obviously the Iowa Behavioral Health Association. Is for the substance use disorder and the mental health disorders within the state of Iowa. So all of us get together once a month, whether it's Zoom or in person. The same thing with ICA, which is the Iowa Community Action Association. So the Iowa Community Action Association, that is working more with our low income folks. So Iowa Community Action deals with Head Start, early Head Start, weatherization, all of community action kinds of things. We have learned through some of the cutbacks, some of the cuts have been going on the federal level, that those federal entities are really kicking themselves that they didn't get ahead of us, that they thought administration really understand and knew the purpose of those programs. And now that there's cuts, you're like, oh shoot, we should have done a better job of really publicizing the great things that we're doing across America. So the Iowa Community Action Association, we're wanting to get all 99 counties to sign off on these four letters. They are for LIHEAP, which is our low income energy assistance program, our Head Start, our weatherization, and then CSBG. So just to give you an idea, if we look at Head Start, do I think it's going to happen? I would sure hope not. And I don't think so. And the reason I don't think so, because if we look at the Head Start program, this isn't just an Iowa thing. Or a new opportunities thing. For Head Start, we do 7 different counties, and we're working with 338 children, and we've got 26 classrooms. So certainly if Head Start were to go away next fall, that would affect those, but it's so much bigger than just these 7 counties. In the state of Iowa, if Head Start were to go away, just in Iowa, there'd be $89 million that would go away in federal funding that goes into Iowa's economy. In Iowa, 7,500 children and 650 families receive those services statewide. 2,300 Iowans are employed by Head Start, and then 5,300 parents are able to work because of these Head Start programs. So these parents, if Head Start goes away, these parents are going to have to hire daycare, or they're going to have to do something in order to continue their jobs at all these different places. And so it's really a big deal that Head Start, it's so important for these children, but it's also so important for the economy and the families and the parents that we're working with. If you look at nationwide, and I just have a couple more stats, then I'll get out. Nationwide, there are 800,000 children and more than 1 million working families. Now, this is documented statistically, 1 million working families. So, Chad, do you really think that Head Start is going to go away? When you look at this nationwide, 800 children are going to be affected. 1 million working families are going to be not going to be able to work anymore. It's crazy. I mean, I just can't imagine how that would work. And so what we're trying to do again is we're trying to get ahead of this. We're wanting our legislators, the Senator Grassley, Ernst, and you can see the whole list there. We're just really wanting to remind them of the importance in Iowa and all 99 counties of why these programs really need to be considered to continue on. All we're trying to do is get ahead of this. And I want the public to know, I want you guys to know. Do I think it's going to happen? I really don't think it's going to happen. I don't want there to be panic, in our staff, in our families that we're working with. It's really important. But we've learned from these other entities that are now gone away. We got to get ahead of this. We got to make sure that we are publicizing the great things that we do. And as Iowans, we don't do a very good job at that. We don't do a very good job at that because we're very conservative and we don't do these kinds of things, but we are now. We've got to now. So I'm asking for Carroll County's support to sign off on these 4 letters. What would happen is if these exact same 4 letters would be emailed to one of you, it would be a DocuSign kind of document. And so you would actually just click, and you'd sign off on it. And then at the end, when all the counties sign off on it, there would be this nice, pretty document that we can present to these folks.
So the reason there's 7 different names down below is because that's for Carroll County's new opportunities for each of their county representatives to sign on, right? On the
First
bottom.
page.
So they're consolidating it all to one page for everybody effective.
So he's basically asking for one of us to sign it.
Yep.
And
That's right. That's,
You can-
we're not wanting all.
Are you
the board.
comfortable with it? You're on
I'm
the board.
comfortable with it, but I want to make sure you guys were aware of that
Yep,
support.
Yep, I think it's good. Good.
So if you guys are agreeable, that's,
I have no issue with it whatsoever. I get it. Yeah.
I think it's a very good idea.
all right. Good night.
Thank you, Chad.
All right,
Thanks.
and so it's gonna go to Gene?
Huh?
Gene, or,
Yep. Gene.
hey, thank you all.
Thank
Thank
you.
you. Thank
Have a
you,
good day.
Christie.
Okay, item number 3, opioid CD decision. I had the treasurer check last week. We do have over $280,000. We can do another 6 or 7 month CD from United Bank of Iowa at 4.4%. The question is if we're gonna form this committee, do we want to put 175,000 in it and leave 100,000 that we could start spending? Or I guess I'm looking for direction on how much money I
How long?
want to tie up.
How long is the CD for?
6 or 7 months, we can choose.
I would suggest that I think your idea.
I was thinking of keeping some out so that if indeed we do go with the Dallas County model and get something going, so we could cut some checks.
Well, and I think like with them that they're showing a need now, and I do agree with what she's saying, that maybe we should wait to see what happens in the state.
Yeah.
We could be chasing money out of bad,
If we were gonna start cutting checks sooner or later, I would definitely.
but I do think we
Keep
need
some
to start moving forward.
I agree.
Does it need to be 100,000?
I don't know that, so that's why I'm asking for a
Because
number.
even if you did 50 and you put the rest back into a CD, obviously it
Yep.
generates the interest, but if
Well,
they did
you could-
15, I guess did they put a monetary number, the other requests?
Yeah.
Manning did not.
I would, we could go 50, and if we do need it, all you gotta do is pay the penalty. It's not like, you can still fold out if you have to.
What do we got in there? 270?
We got a little over 280 now. So if we put,
Put 80 in it, keep 200,000 in a CD.
There.
okay. So
That's
I
what
will,
would do.
That's my thought.
want to make a motion to that, Mark?
I'll make a motion. We put 80 in checking account and 200 in a CD.
I'll second that.
Okay, we have a motion and a second. Do we want to go 6 months or 7 months?
I'd go 6 months.
Okay, 6 months at 4.4% from United Bank of Iowa. I'll direct the
Is there a
treasurer.
difference in interest rate from 6 to 7?
It's the same.
I'd
It's
just
just a
go
matter of
6
how.
then.
So your motion was for,
6 months, 200,000 in a CD, and the rest will go into our checking or wherever.
Second.
okay, any more discussion? If not, all in favor?
Aye.
Opposed? Motion carries. Item number 4, consider for approval door system proposal. Dalton gave us a couple of quotes, and this is a safety committee kind of follow-up thing, security. Dalton, if you want to explain your quotes, I know it's not cheap,
Yeah,
or
so-
explain what the whole, I don't know if you guys know that Chad and Christie both had name badges on. I don't know if those were fobs also, but that's what we're kind of looking at, or you're.
I'll spearhead this for a second. So where this generated from was a safety committee that was generated, and there's a group of a lot of elected officials, department heads that come together and made recommendations or were having discussions on how to make Carroll County as an employer more of a safe work environment. And we've all taken separate actions. Dalton's done a couple things. He's still working on quite a few things. There's other of us like Stop the Bleed and fire, tornado,
Active shooter.
and active shooter drills. So just to kind of get everybody on board, but this is part of one of the safety.
So, yeah, we're looking at, basically moving our system over to, add a bunch of doors here in the courthouse. We'd be looking at adding 2 on the court floor.
Wait, the court floor already has some where you have to badge in
Yeah. So
or fob in.
I understand that expanding our current system as well.
Yeah.
So, we do have some doors involved already, like all the outside doors to the courthouse, one over at the Fridge building. And this will be integrated with that system as we upgrade this. We spoke about some of the benefits of moving to the cloud with us. We right now, if we have a vendor or something come in, I have to give a fob out. I could actually just do a text message to somebody where they open a link, they have 30 minutes to open the door, and that link expires after that. So, there's a lot of simplifying there that happens that would be pretty nice for us. But this basically would make the whole courthouse as a, you know, a little more secure. The first floor, lock up all the, you know, the main office doors there and make them fob access. We can use the cards like Scott, suggested with the,
But aren't those doors locked now, or do you have keys in them now?
yes, so, but the problem is I gotta key them every time they go through them. So
Right,
if they have a
just like your
fob,
badge.
which they go in the building now. they
Like
pop-
this.
They pop through.
I understand that, but I mean,
I'd be like when you go to the auditor's office, they have to scan it.
Well, the thought was more security, because right now anybody can walk in the recorder's office, you know, you can just open the door and go in.
It's not locked.
We've got,
And another thing that this also brings in is logging, which is important. You know, we have some doors with documents and things like that, people going in and out all day. This creates a log, who's going in and out, you know. Every person that goes in, they scan their fob, and then that's in the system. You know, there's a lot of other benefits to this too. I mean, we've added, you know, almost from this whole thing, so it's a pretty big system, so, yeah.
pretty big dollar for ticket too.
We also talked to two different price tiers as a safety committee. We kind of thought the more expensive was a little better. Could you explain that a little bit to everybody?
Yeah, there is a little bit of price difference in the two quotes. You know, I know it's negligible at being $43,000 quote altogether. I think it's like a $800
Yeah.
difference, but the difference is whenever anybody scans can keep off with the more one has an integration where it takes a picture on that camera for close to the door. So then with that log, you have a picture of the person who scanned the fob as well. So, or scan their key card, whatever they have for access. So.
I have a question. If Courtney's sitting at her desk back by the window and she wants to let somebody in, will there be a button that she can push to buzz her door to allow it? Or will they have to get up and manually let them in?
So that's a good question. You know, one of the concerns is like, you know, people come in on Saturdays and stuff like that, they have an issue with the door, we have to be able to fight them. The system now is not that great to work on. With this new system, you'd be looking at, I could give people app access where they download a cell phone app on their phone. So we'd have some administrative people from the county maybe have that app. And then they can work the doors just as easy as I could open from their desk, from their phone if they wanted to, for example. Or let's say a door didn't cycle on Saturday when Courtney has voting, she can get on her phone to cycle it on and off and maybe fix it if we have an issue. So, yeah. Just giving her available more control of the system and trying to bring it up to age. You know, currently it's ran off a computer somewhere here in the courthouse on the network that they control the key fobs for everything. So it's kind of archaic. Yeah, but with this upgrade, I think, you know, having all the doors on like a key fob system, this makes sense. That we're gonna have 28 doors around the whole the system. So
And is there the capability of doing a time clock with them as well?
so, you know, it does log, you know, what time you get on and out. So as far as like a
Not out, just in.
well, yeah, I'm sorry. And
Okay.
Every time they use the door?
Yeah, every time they use the door. So as far as time clock goes, probably not, maybe the best.
Well, you just remember Courtney from the audit, we get dinged, but I think we've got that fixed now, just having a little bit more of clarity on hours worked.
And if there was a discrepancy ever on hours worked, we do have camera footage, you know, of the whole courthouse.
Okay.
So it's not like we couldn't pull camera footage, see what time somebody came in, see what time somebody left to verify, you know, hours worked. So.
Was a follow-up from the safety committee meeting. Panic buttons were also part of the discussion, and that's a total separate quote that might be coming.
Yeah, yes. So the problem with the panic button systems, everything I've ran into is pretty expensive. I know I'm bringing a $40,000 quote, but honestly, for 28 doors, this is not outrageous. I've done my homework and I've looked. I think this is about a half of the quote that we get from John. So I know it seems like a big amount, but they have to put strikers in every doors, which you know, makes them have to shut the door frame out, or the door handle will open there. They gotta run wires to every door. There's an expansion needs to happen back on our alarm panel now to make this integration happen. And the other things on the back end that has to happen, so.
Courtney did send out your analysis of the
Yeah.
quotes also,
Is
which.
there anything we'd have to upgrade software every year, or something like that, a cost of that, or license for it, or
So
something
there is
like
a
that?
license fee. I mean, that's gonna be like $1,000 a year.
A year,
Yeah,
something like
so,
that.
but I mean, I would absorb that into one of my software costs would be the plan with that, so.
I think it's a good idea, but that's my opinion.
What's your thoughts, Zach?
Yeah, I think we're actually kind of
So do I. I mean, we're pretty easy access. Anybody can just walk in and office.
And we, in the judge's chambers, 1 second, we've had this sort of system installed for years. So to me, it's kind of like, well, why are they so
Exactly.
protected? You know, why are they so much different than all the other employees? I feel like this should have been installed years ago. And Dalton finally took it and grabbed it by the horn.
So
Took initiative.
if I have a fob to get in here, I could open any door in the courthouse.
If I need security for permission.
I would have security for certain doors.
Yeah.
So everything's granular. I can say any of the doors that we have on the system, you can either open or close. I can put that on. the system.
Courtney can use it as a prevention to keep you out of her office and you have to stand at the counter
No
if
more bit of
if
honey,
she
Jane.
chose. Just tonight, just putting a thought out.
Okay, I know how I'm gonna vote now.
I'm in favor of this, you know, it's something that needs to happen, like Zach said. we-
The
it's on
entire
this year.
safety committee is in favor of it, and that's what started the whole process.
Yeah.
Yeah.
And I
Well,
think
I
that,
just, I think it's kind of shocking me that we just did this remodel, now we gotta come up with this, and I think it's a lot of money.
Well, the thing about it is I actually did give you guys a proposal during the remodel and it was denied.
we were trying to value engineer everything at the time. As far as keeping it so that we had to use the
Well-
least amount of lost money.
That's when the court doors actually got done, that Zach mentioned, I was gonna say that earlier, so we did get that in, but yeah, that was one of the things we cut was.
So you're saying I'm getting old and I don't remember.
Yeah.
We would do that.
In a roundabout way, yes.
You're getting good at reading between the lines, Ken.
So how I know how I'm gonna vote.
So the,
And like Dalton said too, a lot of with the bid price, a lot of it's the equipment. The product is expensive to install. So kicking this down the roads,
Gonna get more.
you're not gonna benefit yourself by
Where
any
does this-
means.
where did the funds come from on this?
we put money in the budget last year. Courtney, was it local option sales tax we put in?
There's money in lost and money in the capital.
Yeah.
You guys would just have
Just
to
ask.
decide
Yep.
where you want to spend it out of. It wasn't for this, it was.
So
for
is this
painting
something that
and
can be
stuff like that.
maintained by our staff?
What's that?
If there's an issue, is this something that can be maintained by our staff, or do we have to wait for somebody to come and repair it?
No, so like this is our current system, it's something that I work on, I learned our current system, I can program a fob, I can program parts. You know, even now I buy my own fobs on the internet and program them, so,
And you said EMA has the ability to print out the name badges.
yes.
There are fobs.
Yeah, so I actually have some of those, we were speaking of those, it's just like a hit card. But if you put their face on it, you know, make it an actual ID badge, and it also would be in the building as well.
Which I think that's what it should be. I mean, we're like Zach, we're behind the times. This is everywhere else you go. They got this.
When everybody else is identified too.
Yeah.
It's that way you know who's an
Yeah.
employee and who's not.
Did you ever get quotes for painting and carpet down for the lower level?
I decided to hold off on it, I think, until we figured out
Ooh,
We're
or
doing this
what?
Project.
if we're doing this project, and we don't really know what those rooms downstairs are getting
Are
used
gonna be,
for yet. I
okay.
mean, there's talk about comm center possibly expanding into that.
EMA moving over here.
And then, yeah, so kind of put a halt to it, just
Okay.
to see what's gonna happen with this.
So you would like to see this project move forward first, and then we'll kind of decide where and how we're gonna go with the lower level.
Yeah, I would say if we had a for sure plan to put the basement, like, yep, we're doing this and this, then, okay, let's
Okay.
move forward with it, but it's kind of up in the air right now, so why
Okay.
spend money on that when we don't truly know what's gonna happen yet down there, when this is. Anything Dalton's done its own purpose, it is.
I'll make a motion to go ahead and approve the quote, the second one for, what was the total of 40,000?
44,563.
45, that's the one with the cameras. All right, we have a motion on the floor from Feld Security for $44,563 and
And I would
45
second it
cents.
because I think it's very good.
Second,
Safety.
any more discussion?
I think this is a good thing to show the staff and the employees and keep everybody safe.
A lot of county courthouses have single point of entry,
Yep.
and I'm not saying that's headed our way, but some courts are demanding it, and this is a step in the right direction. All right, motion and a second. All in favor, say aye.
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 Reluctantly, I.
Opposed? Motion carries.
Can I ask a question?
Yes.
So, ICAP gave us the $3,000 for grants for safety and it got put in the safety budget. Was there a plan for that $3,000 from ICAP?
Yeah,
something else?
On Friday, we ended up doing,
Okay.
Batteries.
batteries and stuff
Yeah.
for the
AEDs.
Yeah.
Okay, I was just curious if we could use some of that, but.
Questions?
Okay.
No, is there a question?
I guess so before.
Good question.
Thanks, Zach. Thanks.
Thanks,
Thanks,
Alden.
guys.
Okay, set public hearing for our last fiscal year 25 budget amendment. I wrote down Courtney, you're suggesting May 12th at 9:30.
Yes,
You want to review it sounds horrible at first.
well, it is what it is. So I'll just go through, I'll start where, basically just lists things by fund. I think that's the easiest to understand. So the first thing we have is the CDBG housing program. Carla kind of explained that we were given that money back because somebody sold their house before the period. So that money's just been sitting in reserves and they'd like to be able to use it. So we need to put that in to be able to spend it. So that's 11,536. Unfortunately, the next one is unavoidable medical examiner, $24,000. Hazmat funding, that was just, I don't think I read the EMA's budget very well, but we pay 31,224 every year for hazmat funding. And that did not get put in the budget last year, so.
And that's
just-
a per capita number, isn't it?
Yeah, and when I look back at EMA's budget, it wasn't listed like Sarah had always listed it because we had a new EMA. So got it corrected for this year, but we need to pull that money to pay hazmat because that line's over.
You paid every quarter though, right?
Correct, yeah. Another kind of unavoidable is the juvenile attorney's fees. Put 5,000 in there. The next two are kind of offset with, well, the next one is offset with revenues. Environmental health has apparently done quite a few well closing and testing, so that's kind of an in and out. So 19,757, but it's also offset by the additional revenues they collected, which that's a good thing. On the health insurance, there's just a change, so 3,037. The next one's kind of a bookkeeping thing, but we paid a rent for a client for general assistance and they cashed the check and then realized that we'd already paid them. So then they cut us a check back to reimburse us, but they asked if they could get that put back in their budget so they could still spend that money. So it's just a in and out revenue and expense. The next several are conservation. Those were requested from the director out there. Equipment repairs, 27,983. That was the board had. He approached the board before that repair. I think it was to a tractor, if I remember correctly. Sanitation, which would be just trash, $2,500, and environmental education is offset by a community foundation grant that they received in the amount of $3,000. Trustees, just $1,500. It's kind of a guessing game how many times they're going to meet, but we're running a little low on that. So I just, with them all turning their budgets in, I wanted to make sure we had enough to pay those guys.
Is there a max they can meet 4 times a year?
Yeah, I believe so.
Okay.
Yeah. The next one is just a new hire in the treasurer's office. The board always recommended budgeting for a single until you knew what they were going to take, and they did not take a single. So we need to put some money in the treasurer budget to offset that additional expense for her. Auditing expenses, as you know, they've doing our audit, they are always extending into the next year. So last year we paid for quite a bit from the year before, and this year we paid quite a bit from the year before. And I think they're moving forward on the current one, so I'm hoping it'll get paid for in this fiscal year. So I wanted to put some money in there to cover that for the audit. Let's see here, courthouse salaries. We had quite a bit more time put in by our part-time person just with the remodel and moving around and just the things that they were doing. So there's some additional monies there. We just talked about this safety committee, the $3,000 we got from ICAP. I'm just putting that back in the safety committee line to offset that. And employee life insurance, that's the money we pay Dearborn. That's kind of running a little low too. So I just put additional money in there in case we need it. $500 is all. If you go back over to the revenue side, you can see a couple small revenues transfers. Just trying to clean up our TIF fund. Our TIF's been inactive for 5 or 6 years and there's like 37 cents or 47 cents in there. So I'm just doing a transfer to get it out of there so that fund will have a zero balance. Kind of the same thing with the jail capital fund. There's just some money left over there from that project, so just cleaning that up. So that'll go back into the general fund. That's why you see them as revenues. So in the general fund, the what we'll be pulling from reserves, expenses less revenues, $151,497. If we move down to general supplemental, there's just one item for our 10X. That's our electronic poll books. So last year we had to pay our final bill to the precinct atlas plus the 10X. So I didn't budget to spend both of them because I wasn't sure how that was going to bill out. It is $2,295. But that'll be a one-time thing because next year we'll just have the one fee instead of both of them. So out of the general fund, it's $2,295. Moving down to recovery funds. So there's $232,683 left over from our HVAC project that's been just sitting in this fund. This would be a transfer to move it back to the lost fund where it came from. So then the recovery fund would be a zero. So it's $232,683, but technically it's not really an expense. We're just moving it back to where it came from. All right, so then we got real basic. The sheriff had a windshield repair. You can see the revenue going in from ICAP and then the expense coming out because they already paid that bill. And then unfortunately, he's got some overtime, amount of 20,000, and then FICA and IPERS to go along with that. So in the rural fund, you can see pulling from reserves, $23,232. Moving down to local option, you can see the transfer going in revenue back in there. Secondary roads, I believe Zach talked to you all about this. That's for the roadway maintenance, $575,000. That'll be pulled from the roads reserve fund. Moving down to the TIF fund, you can see that $1 coming out of there. It'll be going into general basic. And the jail capital fund, $15. So yes.
Question, and I don't know if has anybody talked to the sheriff? So if the new hire, would we be able to eliminate some of that overtime?
Well, I think that's the problem till he gets that person back on. That's why this
I
overtime's
think
happening.
that duty may have been somebody who's in the guard.
But still though, would we
You're
be able
covered for
to
him right now, is what you're
alleviate?
saying.
Yeah, in the future, alleviate some of this overtime.
I
would think so,
I
because
would hope
that's-
so. He also has one person that's out on
Yeah.
leave
Yep.
too.
Yep.
So
He mentioned that in one of the meetings before. He said, I've got somebody, we're covering all the areas, so I'm sure that's why we've got the high overtime.
Okay.
So you can see the total is $752,040, but you could take, the 232 out of loss that we're just moving around. So it isn't as bad as what it looks. But
On the 575,000 for secondary roads.
Yeah, I
it's
mean,
just
that
the way
was-
the calendar year falls.
correct, that was already sitting in their
So
fund
you can just flip it
anyway.
back, yeah.
So,
Zach's
but that's all I have. Does anybody have any problems or concerns with any of these or questions?
Thank you for taking the time to go into depth on every one of them.
Yeah, hopefully it makes
No
sense.
questions.
I'll make a motion to approve setting up the public hearing for May 12th at 9:30.
I'll second.
We have a motion and a second for the public hearing, May 12th, 9:30. All in favor?
Aye.
Aye. Opposed? Motion carries. Item 6, manure management. Brook Feedlot, Section 35, Nice Township. Change crop rotation or optimum yields. Item number 7 is committee reports.
I can go first. Last Tuesday, we had a safety meeting and we reviewed all the thing we just approved with the safety badges and things in the courthouse. And a DCAT meeting yesterday, that program is hurting a little bit. They think they're gonna get funding taken away, so we're hoping to hang on there for a while with all the stuff going on. And then I cruised the county with Zach on Friday, about 6 hours, wasn't it? We found a lot of stuff, a lot of neat things going on. Went down, checked out the grinding down of the road on north or south of Manning there and checked on a broken county tile and just very, very good and informational meeting. Saw where our gravel pits were and all that neat stuff. So that was very good. This week's supposed to have a Carroll Area Child Care Meeting tonight at 4:30. And then I'm gonna go cruise around with tour with Jason Christensen tomorrow with the conservation. We're gonna see all the sites and all the things we've got going on with the county conservation. That's all I have for this week.
I can go next. Last week, Monday, after I left here right after the meeting, I did a federal review for Head Start out at New Opportunities. That went well. Then I did attend the Region 12 open house on their house that they rehabilitated up on 11th Street that day. And then Thursday, I had CCGP Executive Board meeting. And then I had several calls. I talked to Zach a couple times about different topics. This week, after this meeting, I have a meeting at Maple River in regard to their sewer system. They'll be here. And then Tuesday, have a special meeting at CCGP and then also have a CCGP board meeting at noon. And then policy council Tuesday night, and then Friday's ES Center.
I can go. Last week, Monday, I went to the same open house you spoke of, Gene. I also went to the city council meeting. Tuesday, I did receive a call from a concerned citizen about the ambulance service not doing a transport. I called Jamie, who was aware of the situation, and he sent an email back to the citizen explaining how the ambulance service operates. 10 o'clock on Tuesday was the safety meeting. And Wednesday, I got some more phone calls about wayfinding signs along the Sauk Rail Trail. Referred them to Mike and Jason. Thursday, went to look at the milling operation after a property owner had some questions. I think you guys might have went
Looked
there on
at it, yeah.
Friday also. And I think Zach returned a phone call to him. And we'll see how that turns out after the asphalt's laid. Friday at noon was Access DC trip planning meeting. And I did Friday, Maggie also sent us an email about Stop the Bleed on the 29th. I forwarded that to the courts, so hopefully they are going to participate because they're going to have one of those kits on their floor. Today I have newspaper radio. I'm going to attend the same Maple River sewer meeting with Gene. Tomorrow, same CCGP meeting at 10 o'clock in the morning, and then at noon is our regular meeting. Thursday is secondary roads claims, Friday courthouse claims, and Saturday is the last legislative forum at the Kretzinger Building in Coon Rapids.
Last week I had the safety meeting. Courtney, did you guys receive all that information on Stop the Bleed next Tuesday?
Yeah, it was sent to all the department heads.
Perfect. Hopefully you guys can schedule so that you guys can all
Maggie
see.
sent out a thing for Tuesday.
Yeah.
Hmm?
Maggie sent out
A week.
I saw that. I was just making
Yeah.
sure everybody
Yep.
was aware
As
that's,
far as I know, everybody got
Yeah.
it. Yeah.
that was it for last week. I did receive a phone call and about ambulance service. Again, the ambulance service is for 911 emergency calls. It is not for certain different reasons. This upcoming week, I don't think we have to run over to Wesco. We have a board member that's going to be retiring. But that's not a business meeting, so we'll see how that goes. I don't know if I'll go or not. That's it. Friday I'll do claims, and I don't know if I'll make it down to Coon Rapids Saturday, but I'm gonna try to.
Any questions from those in attendance or comments? Courtney, next week,
Public hearing for zoning.
for all the ones that were in the Glidden and Carroll 2 mile.
Oh, payables.
All right, motion to adjourn from anybody?
Second.
We have a motion, a second, all in favor? Aye, opposed? Meeting's adjourned.